one issue with, and it's the majority of patients diagnosed with POTS, is there's a propensity to develop high intracranial pressure. That is treatable. And as eye doctors, that was one area I was fairly comfortable with. But it doesn't exhibit as what we would typically see. As eye doctors, we usually look for a swollen optic nerve. It doesn't exhibit, called papilledema. It doesn't usually show. The MRIs sometimes will give hints of that, but not always. So idiopathic intracranial hypertension without papilledema is the thing. But as clinicians, we forget about it. And as patients, we go to doctors so incredibly ill, and they're not necessarily tuned into those symptoms. And the number one symptom we see with that is more neck tightness, discomfort at the base of the skull, not so much headache as we learn in school. So, but figuring that out and treating it was like, oh, thank God, that helped. So that was hugely helpful. And IIH, when it occurs, it's always a secondary problem. Okay, it's a significant one, but something's still driving it. And then as an eye doctor, I thought, we can't all be having normal blood work, everything looks good, and be this sick. Where could we look in the body to help figure this out? So my comfort spot, Adam, was in the eyes, right? So one of the first studies I did was gathered a bunch of patients and a bunch of age-matched normals. And we did all these ocular tests on them. I was the blinded doctor, meaning I was presented with images of the back of their eyes, patients or not patients. And I wasn't told who is who, and I had to guess who's a patient, who's not. I had no idea what to look for. So I just considered everything. I thought, okay, well, this is a little weird. I guess as an eye doctor, we wouldn't call it. I'd probably blow right past it. But I started to see patterns, and those patterns were a huge clue into some of the problems. The patterns included some irregular optic nerve margins, perhaps suggesting mild idiopathic intracranial hypertension, that possibility. The other one was the vasculature. And the eye, of course, is the only place in the body we can look directly at blood vessels. We don't have to look through tissue or anything. And I was looking very closely. And there is a tendency in the patients to see the arteries were a little bit smaller. There is premature atherosclerosis, plaque formation, even like children with POTS. And the veins tended to be larger, and importantly, the caliber wasn't always smooth. It was irregular. And ultimately, I was able to figure out that's mild fibrosis or scarring. Could patients with POTS be subjected to chemicals throughout the bloodstream that's damaging the vascular endothelium? And if so, what the heck is that? And then what other problems is that causing, et cetera, et cetera. So quite the journey, but those were two very important things to figure out.
Wow,